Well, ACL injuries these days, probably a 9 to 12 months physical recovery, but the whole mental aspect of trusting that knee again takes probably about another year. We see very few people come back at that 9 to 12 months, and they're just like hammering it. So, the interview with Sean McVay afterwards, they were talking about, oh, we need his effort to be blah, blah, blah. But you got to understand there's a mental health component to these injuries. And if somebody doesn't quite trust their joint yet, it's hard for them to go hard. They want to be there, they want to do it, but there's this psychosomatic, this mind-body phenomenon that just prevents you from doing it. It's kind of like, standing at the edge of a cliff. What's your automatic reflex? You get nervous, you're going to back off a little bit. That happens with these ACL injuries as well. The groin injuries are super stubborn. Most of them are muscular, but if they get high up, that sports hernia, where the tendon attaches to the pelvic bone, those can be very, very stubborn. They're often recurrent too. Most of our athletes, they're so strong, they get quite tight. And then when tendon and muscle get strained, they don't heal with tendon and muscle. They heal with scar tissue. That scar tissue's got no pliability. So you just kind of re-tear the scar, keep re-tearing the scar. So we always push our athletes back 2 to 3 weeks too early. They re-tear the scar, and then it's kind of like on and off, on and off. They can be very stubborn.